a Curcio shirt to match my Curcio shirt. This is the best is yet to come. Didn't plan that.
I'm Brad.
I'm Rach.
The kids are in bed. Welcome back.
Welcome back. It's been a little while.
We had a baby that had surgery. Well, I guess it's not technically surgery. She had a procedure.
In the OR.
In the operating room.
It felt like surgery.
Yes.
So we wanted to run you through our experience of having a baby have major surgery before COVID-19 and then a procedure in the OR after COVID-19 and compare those, how they were similar and how they were completely different.
In case you're new to our channel, our daughter is now 6 months old, but when she was just 20 weeks old in utero, they discovered that she had a very swollen kidney, hydronephrosis. And so, 3 months after she was born, we finally figured out what the true problem was?
Yeah, probably around then. She had a lot of testing done on her, which was not fun. We had to go up to a women's and children's hospital in Columbia, Missouri. That's about an hour and a half away from where we live. So we had to go up multiple times and have different tests done to try to figure out why her kidney was so dilated.
So it turns out she was born with 2 ureters coming off her left kidney. And one of the ureters, they were, even after we did like an MRI and a dye test, they still weren't sure where the ureter, the second ureter, entered the bladder.
Or if it even did enter the bladder.
Right. The surgeon recommended basically just cutting the extra ureter, putting a stent in, and connecting the 2 ureters together.
Because it was like an extra ureter, it wasn't efficient at draining the kidney. A normal ureter has a directional flow and it has something called peristalsis that helps move fluid in the correct direction. And this random extra ureter did not have the components that a good quality ureter has. And so it was just really not doing a good job. And it was supplying the upper third of her kidney. So that whole upper third was just really backed up and possibly causing her pain. We don't know. She didn't act like she was in pain. But the purpose of doing the revision of this was to hopefully get her entire kidney draining properly and save the function of the whole kidney. We figured out with the testing, a few tests that were done separated by a few months, that the function of the kidney was going down, having it be dilated like this. So it was worth trying to save it to our surgeon.
Yeah.
And to us.
So pre-COVID, when we went in, so we stayed in a hotel room the night before. Didn't have any problem checking in, talked to people.
Got dinner.
Pressed the button on the elevator without washing our hands.
Didn't think about a whole lot.
And went to bed just fine.
I would say like the stress leading up to the surgery was only around the surgery. Mm-hmm. It wasn't around going into public, that's for sure.
Right.
So yeah, it was stressful, but.
And then we went to the hospital together. We got checked in at the front desk. They made us a badge so that we could be visitors. And we had someone escort us up to the surgical suite waiting area.
Which was completely full.
Yeah, which was super crowded. And then she had a procedure and everything else after that is normal.
Right, yep. So it was kind of what we expected, I guess, if your kid's having surgery. Mm-hmm. So fast forward to 4 weeks after, she had a stent that was left in to just help direct the fluid while everything healed, and that stent had to be removed. And we did think, we got a call, or we called. We called. It was so confusing. We called to make sure everything was still gonna be on.
Like,
because of COVID-19.
Probably only 6 days prior to the procedure,
right.
We called.
And she got back to us and said we're rescheduling it for 2 months from now.
And so Rachel asked the question, well, you know, the surgeon wanted to take it out between 4 and 6 weeks after the original surgery. So what do we need to be on the lookout for baby Eloise to know if she's like in distress or something's going wrong? So the surgical coordinator's like, well, let me ask the doctor, I'll call you back.
She calls back and the doctor decided that it was probably not a good idea to leave the stent in, and she wanted to go ahead and get approval to have the procedure done in the OR on the originally scheduled date. So it was kind of one of those things where, like, had I not asked that question, would we not have had this done and behind us? So it was, I don't know, that was kind of stressful. Like, does she know this is for sure the right thing to do? Because it seems like she's a little on the fence.
Yeah, exactly. So I had booked a hotel room when we actually, like, right after the initial surgery for this, you know, procedure. So I canceled the hotel room.
But then we got the call saying we are gonna have it. So then it's like, we ended up booking the hotel room again. We thought initially it was gonna be later in the morning, but then it got pushed to first case of the morning. So we ended up rebooking the hotel. We did toy with the idea of just driving up the morning of to eliminate that middle step of staying in a hotel, but I'm kind of glad we did, even though I did not sleep well.
Yeah.
Neither of us did.
We were super cautious, didn't touch the elevator, used hand sanitizer, stayed the heck away from everybody.
Yep.
So
there was nobody, like, we didn't encounter anybody.
No, it was a dead hotel for sure.
Right.
Which is crazy because it's just this giant hotel, like, in downtown Columbia, Missouri.
And that leads us to the hospital too, which is a bustling hospital. I mean, every time we were in there, it was packed with people. It's one of the major hospitals in central Missouri for pediatrics. So Brad could not go with me. Only one adult could accompany her for her procedure. So it started off completely different. Brad dropped us off and I went in, and immediately there was a guard sitting there, and he just pointed, because like nobody was getting within 6 feet of each other. So he just pointed and directed me through a curtain that guided me to a table where I had to sign in, use hand sanitizer, and then she checked the temperature. She checked everybody's temperature that came in the door. So that was the very first thing that you experience when you walk in the door. And then you go over to patient registration, and literally everything was wet. The chair at patient registration was wet because it had just been wiped down. The counter was all wet. And that's where
we were the first procedure of the day.
Right.
In the OR.
Right. So, I mean, we were presumably the only people that had been encountered even. So anyway, so we were sitting there getting registered. Eloise was getting her little wristband. The girl behind the counter at registration was using hand sanitizer multiple times throughout, like, our encounter, which only lasted 45 seconds.
Was she wearing a mask or no?
She was not, no. I just felt bad for the whole staff there because they were all of, like, the vulnerable age.
Yeah, I think most of them are volunteers. And so I think they're retired.
Oh, that makes sense.
Right.
So then Eloise, while we're sitting there, she, like, swallowed down the wrong pipe, which she does frequently. And I could tell, like, she was getting ready to choke. And her eyes got watery, and then she started coughing. I was like, no, cough right now. But you could see everybody just react. And I'm like, I swear she just swallowed down the wrong pipe. She's not coughing. She doesn't have a cough. So, and then Eloise and I were escorted up to the waiting room before we got taken back by a lady who had to maintain 6 feet from us. So we walked awkwardly very far apart while we kind of yelled back and forth to each other, making small talk. And then... So
did you ride the elevator up together?
We did, but they were big enough for a hospital bed.
Right.
So we could be 6 feet apart in there. But yeah, we were in an elevator together. And then it was, I mean, that next couple of things that happened were pretty much just like the original surgery. Like, we went to the waiting room.
Except for nobody was in the waiting room.
Except there was nobody. There was one guy all the way across the room. It was strange. He, like, had sunglasses on, and I don't know what he was doing there. I don't know who he was. But anyway, we went back and pretty much went right through the whole first process. Like, the first process with Eloise, you could hear people in the hallways the entire time. Like, it just sounded busy, and this time it was not that way at all.
Yeah.
So, and then it was just me by myself in the waiting room while we waited for her. We went to recovery when she was done, which was super quick.
So did the surgeon, when she came out, did she come out to the waiting room?
Yes.
Okay.
She came out to the waiting room, and we went to the little consultation room, but it was almost like we were opposite ends of a magnet. Like, we were both trying to stay 6 feet away from each other. It was weird. And that reminds me, like, anybody who was closer than 6 feet had 2 masks on. They had the N95 mask, and then they had, like, a surgical mask over the top of that. So probably to protect their N95 mask from contamination. I don't know. So that part was interesting, and one of them was saying that it was really hard to breathe through all that.
Oh, I bet.
Which, I just saw a patient in the clinic today for an emergency and had a mask on the whole time and could not breathe. And I was fogging up my glasses and I was fogging up the microscope.
Yeah,
like I couldn't see.
Yeah.
After that, we went to recovery, and that was pretty much the same, except for Eloise was kind of a hot mess in recovery this time. And instead of the anesthesiologist coming to like give us her blessing to leave, she just gave it over the phone. So that was different too. I don't know if it was the difference in the procedure or because of the whole COVID thing.
Right.
So obviously Brad can't speak to any of that because he wasn't there.
I wasn't allowed to come into the hospital. She was only allowed to have one, not visitor, but one
Parent,
yeah.
Did it make you uncomfortable that you couldn't be there?
Not with like text message, and like I totally trust the hospital and the surgeon, so.
If it would have been the original one, would it have been uncomfortable? The big one?
Yeah, yeah, knowing that they were gonna cut her open and stuff. Cause this one, they didn't cut her up. They just went through the bladder and pulled it out, so it wasn't a big deal.
Right. Yeah, I guess there's the potential, that's why it has to be done in the OR, there's the potential for something to go wrong, but obviously everything went great and she's great. She recovered perfectly, didn't act like she was in any pain at all, so.
What a difference having pre-COVID versus post, well, in the middle of
midst
COVID.
of COVID, yeah. Totally different experiences.
Makes you wonder how it's gonna be after COVID.
Yeah, it will
like
be.
What, because I feel like, so I worked in a hospital. My clinic was we're both optometrists, and my clinic was in a hospital, and we would have inspectors every 2 years. Inspectors would come in and basically make sure that you're following the standards of cleanliness and procedures in place to prevent infections. So it'll be interesting to hear how that is after COVID, because it was a big deal before.
Yeah.
So it's going to be an even bigger deal after.
It totally will. Well, someone commented on our other channel that we're talking about, she said we're the second or third doctors that have been talking about how we're wiping everything down between every patient. Don't you do that normally? Yes. But we're talking about like we wipe down our mouse and our keyboard and like the entire countertop and faucet, whereas normally we wipe down all the equipment that the patient would potentially encounter.
Right.
Not everything in the room. So it was just to a new level, but maybe that'll be the new normal.
Yeah.
We'll find out.
Yes, we will.
Hopefully we do get on the other side of this and it's not just a part of our normal now.
So today's video is a little bit heavy. We're usually a little bit more lighthearted than this.
We have some more lighthearted ones coming up soon.
Yeah. A little bit of couples yoga. What else are we doing?
Makeup, your makeup.
Rachel's gonna be doing my eyes. So, should be fun.
Yeah. Subscribe if you haven't already and hit the thumbs up button.
You might have to give me a haircut too.
I probably will.
All right.
All right, we'll see you next time.
Bye.
Bye.